So, good morning. This is Dr. Brad with Your Health Reclaimed. We have a guest with us this morning that this is going to be a real treat. She's got a really diverse background that allows us to discuss things from an angle that's really unique as far as chronic health issues go. And I've been in a place for a long period of time that I find a real rich engagement with people who have different ideas, different belief systems in all kinds of different aspects, because it forces us out of our own narrow-mindedness into a much broader perspective and allows us to kick ideas around that we wouldn't necessarily think of or entertain on our own without being challenged from someone from a different perspective. So I think this is going to be really rich as far as our conversation goes today. So welcome, Jane. Why don't you introduce yourself, a little bit of your background?
Thank you so much for having me. Always interested in discussing the human experience. So I'm a mental health practitioner. I'm a marriage and family therapist. I'm Oxford educated. I'm kind of traditionally trained, but I've also had a much kind of wilder adventure into different parts of mental health and the human experience, because I've always felt that the traditional psychoanalytic therapeutic lens is very limited. So I found myself adventuring into a very kind of diverse range of healing modalities, from mindfulness through shamanic practices, plant medicine, psychedelics, somatic work, and EMDR. I'm a attachment-focused EMDR practitioner as well. So my lens broadly is trauma, but it's also trauma and attachment, and certainly mind and body. And I do feel that the traditional therapy space has too much ignored the body, shall we say. So I think this is probably where you and I intersect.
It's interesting. As you just said that, I was reminded of two things. My eldest daughter, she, after spending 4 years in seminary, she went back to college and had the idea of getting into marriage and family counseling. And she was, I don't know how far into her program, when she realized how dysfunctional that whole field is over here in the US of A. She came to realize that 80% of the people just wanted somebody who they could cry on their shoulder. They had no intention of implementing anything that was functional or whatever. You were just a paid sobs session. And since my daughter was newly married and wasn't good at detachment, carrying other people's stuff, that she ended up with one of the most unemployable degrees you can have, which is a psychology degree. If you have anything less than a PhD, you can't get work anywhere. Is that the same experience where you're at?
I don't know, actually, because I've always earned as a therapist. I've always had a private practice, so I haven't tried to receive any other kind of employment. But I certainly agree with your daughter in many ways, and it's something I've been fighting in the profession, and I'm very upfront about now. When people come to see me, I say I'm not a holding kind of therapist, meaning that I won't be somebody's every week at 3:00. So for some people, that's just not what a therapist does. But for me, this is a sort of niche that I've been carving out, which is to say, I would like to meet you in the middle of your life and in the middle of your stories and in the middle of whatever you're going through. And I would love to help you resource yourself so that you can heal and grow and optimize your life. But I'm not here to be your mummy, and I'm not here to just hold you and do the same thing every week. I couldn't do it. it would be so miserable for me. And also, I don't believe that it's the right thing to do. I think there are some people who want to do that for other people, and you should go to them. But I,
Yeah.
that's not my skill set. I have another skill set. So, yeah.
You said something that I found really profound in my own experience, and is that you want to meet them in their life. I've got a background, yeah, I've got so many hats, it just sounds impossible. It's ridiculous. And I've been involved in ministry for decades. Something that I've said for a long time, two things that I think is really interesting is one, cannot take responsibility for an adult child. And there's so many adults that are still children that just won't take responsibility. You can't do that. But the thing that really struck me with what you said is reality getting in people's life. If you go to their home and you meet them in their situation, all the traps and all of the facades just fall to the ground, and they're pretty naked as far as who they really are if you can interact with them in their own environment with their own family.
Absolutely. And that's, another area that the way that I'm trained is a bit disembodied, because that's not what we do. We meet in offices, and now, of course, we meet on Zoom. Now, a social worker is a different thing. A social worker will go into people's homes, and that's a much more grounded way of working with people. And actually, one of my mentors was a social worker, and she drummed this into me, is that most psychotherapists are completely disembodied and out of their mind, and life exists on this material plane, and we need to meet it there. It's not only the material world, but the material world is important too. So I had some training in that, even though my license was marriage and family therapist. I did have some training in social work. In fact, I worked at a center for developmentally challenged young men and women, and our job was to really help these people with very, very basic functioning, like tidying their
Mm-hmm.
room and seeing if they could get a job bagging groceries. And, it was a very important part of my training, which is, how is somebody functioning? What are they doing day to day? And, there are so many really smart people in this world who have very sort of sophisticated inner lives, but they're not functioning very well. So we want to look at all of these different levels of the human, right? There's a
Mm-hmm.
lot of different levels that are intersecting, and they're all important on the level of information. And it's not about judging, it's just about seeing the whole human.
Which is something that is interesting. I was on a podcast a while back with a psychologist, and we had an extremely interesting conversation that his basic belief system was that all these trauma responses and things like depression and all that was something that was because of misshapen belief systems. And my interjection into that was that we have all of these factors that are ignored or not addressed that play into that. You take chronic health issues. Everybody with a chronic health problem has depression. Maybe they might not have anxiety, a fair amount of them do. All that ties into hormonal dysregulation with adrenals and some other things. And the conversation was extremely interesting in throwing around some of the different aspects of our humanity that commonly get overlooked from clinical situations because we want to address things from our comfort box.
Right, exactly. And how we all understand pain is so different, right? It's like how we understand color, it's so it's so personal, and there are so many inherited belief systems around this. And I grew up with a father who was in pain, and I used to massage him through my feet. I used to stand on his back to massage him.
Mm-hmm.
And his pain was the pain of an alcoholic, who had inflammation. I mean, you would probably be able to interpret this in a different way, right? Because my lens is all that I have, so I have what I've felt in my body from him, and I have what I understand from my trainings. But I only
But
understand so much
how,
about the body. But he was,
how old of a child were you when you were standing, or probably more like walking on his back?
yeah, so probably, I don't know if I think back to that, maybe like 6. I remember being worried, would I be too heavy, And he was like, no,
Mm-hmm.
no. Like he really wanted his body to be just like pulverized, which I understand now as somebody who will sometimes be just like, oh, I really need a massage. I grew up thinking this was kind of normal, was to have, in a way, to have all this pain hanging around.
Yeah, and you're looking all that through a 6-year-old child's lens, with not having a therapeutic lens, which is going to shape a whole bunch of belief systems in
Mhm.
an interesting way that once you go through your own training, it's like, okay, you got to unwind that whole thing.
Yeah, absolutely. Absolutely. And yeah, I mean, a lot of my personal work has been about, yeah, getting back in touch with that child. And I think the child is the portal for our deep healing, because the child, although the child has obviously a limited perspective in that the child is, only knows what the child knows, the child's felt sense is undeniable. The child's truth is undeniable. Children are so authentic in a way that adults often are not. So when we
Hmm.
get back to the inner child, we get back to sort of emotional realities, the realities we've been sponging up, right? Little kids just sponge up the atmospheric realities of their parents. So, and then we find this through EMDR, right? We travel back in time, the attachment focused EMDR I do, we travel back in time and we find out what was this atmosphere that the child grew up in that we now can unlearn, because we can think it's normal. We can think pain is normal, depression is normal, anxiety is normal, right? This is just like we're pickled in the atmospheres of our parents. We're pickled in the atmosphere of the household and the caregivers. And so that's what we think is normal, these
Hmm.
felt senses. So,
And we all grow up in some sense of dysfunction, thinking that's normal too. And it's not till you get older that that starts to get exposed. It's interesting in what you're talking about this, the sponging. I remember a study quite a while ago. This might have been from the Family Research Council. I think it might have been, is that 80% of the socialization belief systems, the communication systems, all they're established by the age of 4 or 5,
uh,
which is the old world age of weaning, which meant something totally different than getting off of breastfeeding.
mhm,
It meant establishing all of the foundational roots of culture and society and
mm,
communication and everything to give people the foundations to be able to be productive members of society. It was beyond just breastfeeding.
yeah, yeah, yeah. Yeah, I mean, I think, and that's also the beginning of autobiographical memory is supposedly age 4 as well. So there's a lot to unpack there. But I think that the headline for the listener is, the normalization of dysfunction and how we all participate in that. And it's not just a psychological matter. It's also just around us in all ways, shapes and forms, right? There's a lot of dysfunction around, and it's very easy to get kind of entrained in it, whether that's from reading the newspapers or obsessing about your relationship problems or obsessing about your health challenges. There's a lot of other things that we can be doing, right, to sort of fire and rewire our thinking and our connection to life. And I think that the main thing is this remembering that we are creative beings and that we can think about what we want to think about. We can meditate on what we want to meditate on, and we can feed ourselves with the good. We're allowed to, you know? It's
Hmm.
something I do a lot in my work with people. In fact, I was just having a session with a woman who I often have sessions like this with people where they say, "Oh, I don't know what to talk about because things are going well." And then I always make a joke of like, okay, well, we should, not have a session then, right? Or you better come up with something that's going wrong so that we can do therapy. But that's really not the way it should be, in my opinion, or it's not optimal because
Yes.
we,
Everybody needs good news.
everybody needs
And
good
people
news.
think that talking about something good isn't worthy of talking about. If people don't have good experiences, their life loses value. It loses purpose.
Yes.
And the issue of self-respect, self-worth, all of the things that really give someone value vanish very quickly without goodness.
I completely agree. And I think that every single person on this planet has the capacity to empower themselves with goodness. And that is not for me, when I say goodness, that's not coming from a moral or a religious standpoint. It's coming from more of a basic sense of what is nourishing, what is nourishing to you. And, there's a appreciation exercise I teach my clients where, first thing in the morning, instead of going into your default to-do list or problem list, as soon as you become conscious first thing in the morning, you actually just push your mind into listing 7 things that you have appreciation for. It doesn't even have to be gratitude, but it can be the smallest things in the world. It could be, I appreciate the sheets that I'm lying in. I appreciate that chink of light coming in through the window. I appreciate the show that I watched last night that made me laugh. I appreciate that my neighbor's dog didn't bark at me yesterday. It can be the smallest thing in the world. And it really doesn't matter as long as it's genuine. And then you're getting into that vibration of appreciation. And then everything just starts to open up a little bit more. And to me, that's goodness.
And it's interesting, you're talking about simple things, small things, not monumental. And you talk about being, I don't know if you use the word grateful or thankful for the sheets
Appreciation.
you're appreciating,
Yes.
the sheets you lie on. And you think of all the experiences of sheets. You have cotton sheets, you have flax sheets, you have satin sheets, you have synthetic fiber sheets. Each one of those experiences is,
Linen sheets. I love linen sheets personally.
yeah, yeah,
Yes.
yeah,
Yes.
it's
All good
interesting.
experiences. Sheets.
Yeah, and
Yeah.
unless you've experienced some of those, you the mind can go all kinds of different places. You got intimacy that goes on, which a sheep can remind you of abuse. It can remind you of really healthy intimacy. It can bring all these memories. Just a simple thing like a sheet that
Mm.
you got to unravel that whole thing,
Well,
or you may need to, you may
you
not. It
may
depends.
need to, or maybe, I think here's the thing. Obviously, I spent a bunch of time with people unraveling things, and I would never want to belittle that enterprise. And at the same time, we can unravel forever, and we can spend forever on these unravelings. And I think that what's important to do, I would say, concurrently at the same time, as working on things, that we also appreciate things and that we take time to sort of take time out from all of those stories. So if we have all of those stories about sheets, we have a big story around sheets and intimacy and da da da. We can say, okay, yes, this thing went wrong in these sheets with this person in this way. And we can say, and I'm also going to create my own relationship with sheets that has nothing to do with my relationships with men and my trauma and my this and my that. And so again, we remember through these kind of like exercises of like remembering that we can form new neural pathways with our intentions and our thoughts. We say, because I say so, because I think so, because I decide in this moment, I'm also going to create this space for something new. And it's just going to be about me and the sheets.
Yeah,
Does that
as
make
you're
sense?
saying that, I'm reminded of some conversations with some women recently. One, I don't remember the background about that, but I was actually exhorting her, not only giving her permission, but highly encouraging her to give herself some spa time. Go fill the tub, get some flowers, throw it in there, just make it a special regenerative time in there. And that's more of a woman thing than a guy thing. But its value is such a huge reclaiming of self-worth and value.
I mean, don't get me started on spa time. I'm a huge fan. Huge fan. Absolutely love it. I love it. I love any kind of bathing ritual. And by the way, I do know some men who love it too. So I don't know, if it's only a female thing. But I
No,
know
it's more
they love it.
typical, but
More
typical
typical.
isn't absolute only always.
No,
It's just
no,
more typical.
no. So what's your relationship with spa time?
It depends. I've
Yeah.
had a lot of different experiences. One of the wildest ones,
Okay.
I was visiting a friend. Where are you located?
I'm in Los Angeles.
Okay, so it was in this country. It was up in Idaho in the middle of winter.
Nice. Yeah.
I downhill skied a lot, and we were up in Idaho doing that. But he had some friends that had cross country skis. We cross country skied up this river in Idaho. There's natural hot springs along the river, and we're like in the middle of February, so temperature's really cold outside and all that. You cross country ski up to these hot springs, and you have rocks to line the edge of the hot springs right next to the river. You add rocks in if you want to heat it up, and you pull rocks off if you want to cool it off. So you cool it off some, you get in there, and you get soaked, and you get really warm. And once you're cooking pretty good, then you jump in the river. And you'll be able to hold some rocks and hold yourself under the water until you cool off. You jump back in to the hot spring. It's like you got a million needles going in your skin. The sensation of all those nerves waking up from the cold to the warm is just unbelievable. Things like that isn't necessarily like what we're talking about with the flowers and all that, but you have these different experiences. I had another one, second time I went into Russia was second, 2 years after the Berlin Wall came down. First time we got in there as a wall was coming down. And the only way you could take a bath there was in the sauna room. I wasn't used to saunas, and Russians and Finns have the craziest saunas. They're typically high 190s to 212 degrees with as much steam as you possibly can. I have no experience with that, and I'm hanging out in this place because that's where the showers are. And you go in, you heat up, and you do whatever. And after a while, I asked people, so how do you know when you're done? And I don't remember what they said. I thought, I guess I must be done. You climb out of there, but those are, you have these different experiences of cleansing that take you outside of the cultural norm, that just get ingrained into your memory as experiences. And it's great when those are positive.
Yeah, it sounds like those were peak experiences, and they were experiences that woke up your senses in your body in different ways. And that's got to be healthy.
hmm Yeah, you take a bath in a creek that has 2 inches of water, and you do that, or going from the edge of the Ukraine onto the Trans-Siberian Railway, and go to take a bath in a tub on the edge of Ukraine, not knowing they turned the well off. And so I got a bath with 5 coffee cups full of water, and those weren't all the way full. But I was the last one to get a bath before we went on a 5-day trip.
Well, these are beautiful adventure stories, and I think, sometimes we're gifted with these wonderful adventures, or we can create them, and sometimes we just have to do our best with what we've got at home, right? And I think
Mhm.
that we can I'm big on water, you can just reset yourself by turning on the cold tap and say, when I wash my hands, I'm going to, release the stress of my day, or I'm going to hop in this shower and I'm going to release the stress of my day, or I'm going to cleanse myself of this particular thing, or when I get out of the other side of this tub, I'm going to reset my mind towards whatever it is. Meaning, we can constantly recreate our state and have a little fun with it, enjoy
Mhm.
some magical thinking, because I think that's available to us. Well, I know that's available to us all the time.
It's an important thing where you said, like, at the end of the day, you are working with people who have problems. As I said, my oldest daughter, she's not good at dissociation. So
Mm.
she would carry those things in. You are going through rituals of taking and unshedding all of that stuff so you don't take it with you in your day, which is such a hugely important practice.
It's so important and it's so hard to do. I'll suddenly, I'll think I'm flying high and I'm seeing all these clients and I'm a masterful healer and everything's fine. And then suddenly I'll be completely exhausted and I won't have caught how it hit me. So you never know. I think as a healer, as a practitioner, it's hard to always have perspective on, how the work is affecting you. You always get tripped up here and there, but I definitely have gotten better at it. And I actually, in fact, around me, I can show you, I have just think different things, that I use. Like I do Palo Santo, which is a kind of traditional shamanic smoke cleansing. It's a really nice, soft scent. So I'll do that if I feel like the atmosphere is getting too heavy or between clients. And then I also, this is quite spa-like, I use rose water, which is also a kind of, like instant refresh. And all of these things are just like these little tricks to kind of clear the auric field and be like, okay, reset. And I think you don't have to be a mental health worker to enjoy these things.
No, but you're talking about something I don't think a lot of clinicians really talk about, is all good clinicians, they first they connect with the people they work with, and
They what?
that
Say that again?
they connect.
They connect, yeah.
And to really be a good clinician, I think that's an imperative requirement. People aren't used to it, but those are the ones who are going to give you the most beneficial care, is the people that actually connect with you. And in connecting, it takes a tremendous amount of energy and it puts a person in a tremendous amount of vulnerability in that they're sharing the very weight of things that people carry. And you're talking about different ways of releasing that, letting go of that. So you're not internalizing it, but you are letting go. So it's not part of you that you're going to take with you. We're going to cut this one short right here. It's getting a little bit long, and we will continue this on the next episode. So tune in there for this dynamic conversation.